Mental illness has, for the most part, been a pretty taboo subject throughout history. Only more recently are people beginning to be more open about this subject and discuss the issues facing many adults and children today. One specific disorder that seems to be pretty common are anxiety disorders. What is an anxiety disorder, you may ask? Anxiety disorders involve fears that are uncontrollable and disproportionate to the actual danger a person may be in and disruptive of ordinary life and day-to-day activities. According to the DSM-5, a document that helps psychologists identify all the different types of psychological disorders, there are over 10 types of anxiety disorders. All of them differ in what can cause them and the effects they have on people. Some of these disorders include separation anxiety, selective mutism, specific phobia, social anxiety disorder, panic attack specifier, agoraphobia, generalized anxiety disorder, substance medication-induced anxiety disorder, and anxiety disorder due to another medical condition. There are 4 disorders that are most common, and these are general anxiety disorder, also known as GAD or GAD, panic disorder, obsessive compulsive disorder, also known as OCD, and post-traumatic stress disorder, also known as PTSD.
1. GAD, or generalized anxiety disorder. This type is often manifested by excessive worrying about simple events or occurrences in life. This exaggerated worrying can last for days, months, or years, and starts to affect the day-to-day routine of the person. It is very hard to concentrate on daily activities and carry out work, since severe worry occupies the mind all throughout the day. In severe cases, the person always anticipates worst-case scenarios and feels exhausted, overly stressed, tense, and can often have migraines and body aches. 2. Panic disorder. Panic disorder is manifested when a person feels sudden terror without warning, and it occurs repeatedly, which results in panic attacks. This kind of anxiety disorder has symptoms such as heart palpitations, chest pains, shortness of breath, and dizziness. 3. Obsessive compulsive disorder, or OCD. A person with OCD performs rituals and has unwanted thoughts and obsessions. These thoughts and obsessions lead to these rituals being done repeatedly. Most often, people with OCD recognize that they have this problem but can't do anything about their compulsions because of the fear that their obsessions might be true. 4. Post-traumatic stress disorder, or PTSD. This type of disorder is caused by a traumatic event or events that a person witnessed or experienced. Many returned soldiers suffer with PTSD, as do victims of torture. People with this type of disorder experience flashbacks, nightmares, and are tense and irritable. Such symptoms make it hard for them to build lasting relationships, whether at work or in their personal life.
Anxiety can really affect anyone, but there are some people that is more likely to affect than others. Females are twice as likely as men to be afflicted with GAD, panic disorder, and specific phobia anxiety. People are often more likely to have an anxiety disorder if someone in their family has or had an anxiety or mental disorder. Anxiety disorder is much more common than most people would believe, with over 3 million cases in the U.S. per year, which is approximately 30% of the population being afflicted. Anxiety can manifest itself in many different ways according to what type of anxiety it is. But some of the common effects that many disorders share include intense feelings of fear, whether or not they are directed at something particular, excessive worry, panic attacks, and suicidal thoughts, which can also be a byproduct of depression. Anxiety can have many different causes. As stated before, it can go hand in hand with depression, specifically panic disorders. Other disorders can be caused by abnormalities in the way the brain functions. OCD can be caused by an imbalance of neurotransmitters. PTSD is always caused by a stressful or traumatic event occurring where the person who has experienced it relives the event and has flashbacks, oftentimes causing panic attacks. Anxiety is treatable, but not all treatments work for all people. The best form of treatment, if medication is not available, is self-care. This means avoiding alcohol, drugs, smoking, stress, and caffeine, and increasing physical exercise, relaxation, and healthy diet choices. If someone does have access to healthcare, therapy and medications can be very beneficial. Being able to attend weekly therapy means that they can discuss feelings involved with the anxiety, and that can help to diminish those feelings. Some of the common medications people take to help deal with anxiety are antidepressants, sedatives, and nerve pain medications. Some people choose to deal with their anxiety in unhealthy ways that can oftentimes increase the effects the anxiety has on them. One of these unhealthy ways is marijuana use. Some people claim it helps them feel calm, but oftentimes it actually causes panic attacks, anxiety, and paranoia. Anxiety disorders are an aspect of psychology that has interested me recently because I've been affected by them. My mom passed away very unexpectedly recently, and it has taken quite a toll on my life. This event occurred just a week before I was supposed to return to school for my winter quarter of sophomore year, and I found it difficult to return to my studies, even after dropping one of my classes. I suffered from panic attacks in the middle of the night, which resulted in lack of sleep. My grades dropped, so I decided that taking a quarter off from school was the best thing for me. Although this did make my stress level go down, I became withdrawn and depression set in. I gained weight and the frequency of panic attacks increased. I was eventually diagnosed with depression, PTSD, and panic disorder. When I spoke to my doctor about the diagnosis, I did not fully understand what it all meant, and I felt very alone. Because of this class, I've been able to gain insight into my own psychological condition and learn the true cause of how I have been feeling. I personally did not want to take medication if I didn't have to, so I thought I would give it a month or so and see how I was feeling. In that time, I got some advice from some friends who had experienced similar traumatic events in their lives. They told me that an emotional support animal was very beneficial to their well-being. Because of my diagnosis, my campus allowed me to have an ESA and on-campus housing. Many people do not believe in the effectiveness of ESAs, but I am proof that having one can really help. Because I had someone else to take care of other than myself, I was forced to get out of bed every day to walk him and feed him. He has also been trained in deep pressure therapy, which means he can sense when my heart rate goes up unexpectedly due to a panic attack and climbs on top of me to sort of give me a hug. This results in me feeling more comforted and safe and calms me slowly, reducing the length of the panic attack. I've learned many things from this class, specifically about anxiety disorders. I learned that anxiety is much more common than I once thought, and the stigma surrounding mental disorders is very real, because for once I was the object of this stigma. I also learned that it's easy to find support because of how common this disorder is. I found at least 6 girls in my sorority who also had a panic disorder, and I was able to open up about how I was feeling, and I felt much less alone. I also learned that recreational drug use and alcohol can make anxiety worse, which is a little worrying considering how rampant drugs and alcohol are on college campuses. I've really enjoyed this class, and I hope to pursue psychology a little later in my college career. Thank you.